knee surgery. And I thought I would kind of talk to you a little bit while I finish getting ready. It's 5:30 in the morning. Excuse my appearance because you know you can't wear makeup or anything when you go to have surgery. But anyway, so I thought I would tell you all a little bit about why I'm having my third knee surgery this morning. Tomorrow will be the anniversary date of when my first surgery was. And I was going in for a simple arthroscopic chondroplasty, which is basically I had some jagged cartilage under my kneecap that they needed to smooth out. It was causing me pain. And I'll try to insert some pictures as I tell the story of what my knee looked like. So basically, it was supposed to have been like a really quick recovery. I was supposed to have been able to go back to work. I was a respiratory therapist at my local hospital. I work 12-hour shifts on my feet. I have not been able to do that for a year now. So of course I ended up losing my job, which is understandable. They did hold my position for like 7 months, which I'm very grateful for. But you know, that was the beginning of the pandemic, and as you know, respiratory therapist is in the middle of all that COVID stuff, so they needed to fill my position. I totally get it. So that's another reason why I've been trying to work a little bit on my reselling business to have some extra money since I've been out of work. But anyways, so hang on a minute, my mom's calling. Sorry about that. My mom's here to pick me up. My husband's coming later. He's got to take my son to school. Ooh, look at that. Anyways, so basically what happened was my surgeon, which I won't name any names for legal reasons, she used a thermal wand to smooth my cartilage instead of just like the regular shaver that they usually use. My current surgeon that I see now, which is wonderful, said that it's a very controversial tool because of this very reason of what happened to me. If you do not do it properly, if you don't cool it enough with like this fluid while you're using it to smooth the cartilage, because it basically burns your cartilage, it can cause thermal damage, which causes more damage than what you had before. And I'm sitting, if y'all wonder, because it's hard for me to stand up for a long period of time because of my knee. But anyways, and I'm trying to whisper because my husband's asleep. But so basically she burnt, I had like 3rd-degree burns, thermal damage on my cartilage. So of course, my knee never healed, it just got worse. So weeks went by, she couldn't understand why I was still having pain, why my knee was still swollen, and why it was really red and inflamed. And she just kept filling me full of anti-inflammatories. I took anti-inflammatories for like 3 months and it did nothing. She tried a cortisone shot, made things worse. I was in lots of pain. I was still trying to go to physical therapy, which was horrible. They couldn't understand why I wasn't getting any better. It was just a mess. I was still on my crutches like 2 weeks after surgery, and I should have been walking with one crutch like the day after surgery. So basically after 3 months, she said, I think you have what's called CRPS, which is complex regional pain syndrome, and sent me to pain management. So there's nothing else I can do for you. Unfortunately, this is a horrible condition to have, and it happens sometimes after surgery. And I won't get into all that, but it's like a central nervous system issue. And I actually do still have, which the pain management doctor that I see now, he specializes in that, and he still says, I don't think you have that. I think you just have some kind of symptomatic dysfunction because of what's going on inside the knee. So I went and got a second opinion, which is the smartest thing that I ever done. I did not take that diagnosis. And the new surgeon that I'm seeing now did imaging, which she refused to do, because I said, something's not right. Please, look at this again and see what's wrong. And she was like, no, nothing's wrong. I mean, nothing that I did, nothing inside the knee. So that's the first thing he did. When he checked blood work to check for infection, which she never done, and he did another MRI. So he was like, yeah, you have thermal damage on your cartilage. Your cartilage looks horrible. It looks like she did not even do anything. So he said, let's try some PRP injections, which is where they draw my blood and take the plasma out and then put the plasma back inside my knee. And we'll see if that doesn't help heal this cartilage. If not, I'm going to have to go back in and do surgery. So we tried like 3 of those, which is very painful, by the way. Did nothing. So of course he had to go back in and do surgery. So that was in October. So from March to October, I dealt with this. And finally went back to have my second arthroscopic. He fixed all that. He was like, I may have to do a kneecap replacement if it's that bad, if it's burnt all the way down to your bone, which thankfully it wasn't, but he did have to shave off a good bit of cartilage that was left. But he did fix that. So I was recovering pretty well. And all of a sudden on Thanksgiving, the front part of my knee started hurting really bad. And I went back in, he did another MRI, and he was like, now you have patellar tendinosis, which is, I have necrotic tissue on my patella tendon. And he said, it's basically probably because your knee was so weak, your tendon was so weak from all the stuff that happened, and you were not that mobile and using your leg. And, you know, unfortunately this has happened. I fixed one thing and it's caused another. So we tried PRP again inside the tendon, which was horrible. I almost passed out. It was that bad. I would never do that again. It did nothing, unfortunately. So here I am going back in to have another surgery this morning. So basically he's got to go in and cut out the parts of the tendon that are bad. He said if it's really bad, I might have to take the whole tendon out, reconstruct it, and then put it back in. He said, you're probably going to be in a brace for a few weeks with your legs straight, non-weight bearing. It's going to be about 2.5 months to 3 months recovery. So yeah, that's where we are now. So basically I have been pretty much disabled for a year now because of all this. So if you're having this surgery, please make sure that your surgeon knows what they're doing. And if it were me, I wouldn't have them use that thermal wand at all. My new surgeon used the shaver. It worked just fine. He said there's really no reason not to use the shaver. So yeah, that's what happened to me. Hopefully this symptomatic nervous system issue, which sucks. My knee feels like it burns all the time. It's really inflamed, swollen, it's hot. I can't walk or stand on it very long. So they're hoping that all of that will go away, because it did get better with my second surgery until this tendonitis thing started. So hopefully they're thinking that it will go away. So I will try to check in with you guys after my surgery, maybe when I get there, just depends. But either today or tomorrow, I'll definitely check back in to let you know how it went and how I'm doing. So anyway, I'll talk to you soon. All right, I'm here. Got my IV, got my leg cleaned, and I'll be going back in 45 minutes. So I fixed a mess that another surgeon did. I had thermal damage on my cartilage caused by a previous surgery, so he had to go in and shave all that off.
Okay.
But I don't know if it was from the anesthesia this last time, or if it was from all the pain medicine she gave me in post-op.
Oh, okay.
I was
you were sick.
so sick all night. Oh my
Might have been
gosh.
a combination. The pain medicines definitely can make you nauseated.
Yeah, it was bad. But that's the only time I've ever had any issues.
Okay. I'm going to give you something this time called meclizine before we go back, and we'll definitely give you Zofran and Decadron, which we probably gave you last time,
Okay.
to prevent nausea. One thing we could do is a nerve block to kind of help, so you won't need as much pain medicine, hopefully.
Yeah, I checked with the pain management doctor, because I have a some kind of central nervous system issue. Like they thought I had CRPS. So I checked with him first to make sure I could get the nerve block, and he said yeah.
He said that was fine. Okay,
yeah.
good.
So yeah, I would rather get that.
And I don't see that you have any heart trouble at all. You have some history of PVCs,
Yeah.
but no other issues.
Mm-mm. Yeah, they've checked it really good. And it's just, I think it's from anxiety.
Okay. What kind of symptoms do you have that make them think you have CRPS?
My knee gets really red and hot. It swells.
Really?
It burns.
Wow.
Yeah. So I've been dealing with that since my first surgery, which will be tomorrow. It will be a year.
Gracious.
Yeah. But he still thinks it's not that.
Acid reflux, is that a problem for you? Anything removable from your mouth?
So I'm home now. It's about 9:30 p.m. We've been home since about 11:30 a.m. I've just been resting, letting the anesthesia wear off because I was pretty loopy when I got home. So what he found was a little shocking, but kind of not considering what I've been through. So basically he had to make an incision down the front part of my knee. It's about this big. He did not go in arthroscopic this time because he's just looking at the patellar tendon right on the surface of my, below my kneecap. And he said the part that's on the side of like the outer part of my knee, outer part of my leg, was the worst. He had to cut a big portion of that away and then a little piece on the inner side. But basically, I had thermal damage on my tendon as well. He said I had scar tissue there, which indicated that surgery had been done there in the past, and he did not touch that area when he did surgery the second time, back in October. So basically, my surgeon that done my first surgery that screwed my knee up to begin with also touched my tendon with that thermal wand. She was not supposed to do anything with my tendon. There was nothing wrong with my tendon. It was just the cartilage under my kneecap. So he did not see that when he went in October to fix what she had screwed up, because she wasn't supposed to even do surgery on that part of my knee to begin with. So he didn't see it because he went in arthroscopically that time and just wasn't looking for that, because it showed on the MRI that all my damage was on my cartilage. So it's very frustrating and makes me very angry, but you know. So he cut all that away and like sewed my tendon back up, like, you know, in the middle or whatever. Then he had to drill little holes in my kneecap bone, my patella bone, to help promote blood flow. I think he called it a microfracture procedure. So he said your bone is supposed to be really dense, and when he went to drill the holes into my bone, it was like not, he said the drill just kind of like went right in easily, so it meant that my bone was like really soft there, like it was dying. So he said he doesn't know if that's from what she done or what. He's not sure what made that happen. So he had to actually cut away that part of my bone also, you know, and drill the little holes to help promote blood flow to the tendon. He said that I bled really bad out of the bone, which was a good sign because that meant that I had good blood flow there, and that will help a lot. He initially thought that he was going to have to put me in a leg brace to keep my leg straight for a while, but I did not have to do that. And also thought that I was going to be non-weight bearing on my leg for a while, which is not the case anymore either. So I'll be able to start putting weight on it tomorrow. I've been trying to bend my knee starting today, and he also had to manipulate my knee to get my bend back because it has hurt so bad the past couple of months that I have not been able to bend my knee hardly at all, which I was doing great with that right after my second surgery, the one that he went in and fixed all the crap that she done. I was almost bending my knee back normally the way it's supposed to be, and all that's kind of regressed since then. So yeah, so that's where we are. I'll be starting PT pretty soon, probably next week, and we'll try to see if we can get this better. He is pretty confident that this will fix everything, but he can't give me 100% surety that it's gonna fix everything. He said if it doesn't, he will be sending me to some of his colleagues that is at Duke. He says that they see weird things there, and he said hopefully they will be able to work with me and see what's going on. But hopefully what he did today will fix everything and I will get back to normal, because I miss my old self, and I miss being active, and I miss working. I miss my patients and stuff, because like I said, I'm a respiratory therapist, and I've done that I'm 42, so I've done that for 22 years. So yeah, I miss it, and I want to get back to that. Plus, doing my reselling gig more than I've been able to. So, but anyways, just wanted to hop on and tell you guys how it went, and because I know I've mentioned, a couple times in my previous videos that I had, my knee was messed up and I'd had so many knee surgeries. And I just wanted to kind of jump on and tell you guys what actually happened to me, and hopefully it'll help someone to put the word out to maybe not pick a surgeon that uses a thermal wand to do your chondroplasty. Use the good old shaver that they've been using forever. So yeah, but anyway, so thank you guys, everyone that said a little prayer for me today. I really appreciate that, and I will keep you guys updated, and I'm just going to get off here and probably go to bed. I'm still tired, and just the anesthesia still kind of got me loopy, and the pain medication, which I'm not in a lot of pain. They put a nerve block in that helps a lot. My knee's pretty numb right now, but it'll start wearing off tomorrow, so tomorrow might not be a good day, so I thought I'd go ahead and jump on here and tell you guys how it went. But anyway, so I'm gonna jump off of here, and I hope everyone has a good night, and thank you so much for watching. Bye.